in Bradford District, there are 7,000 children on CAMHS waiting lists. Be specific about CAMHS. Some are waiting up to 4 years for an assessment for ADHD and ASD, and anecdotally there are some areas where we're talking 8 years for a child. So when you're talking more generally about, community health services, can you be specific, please, about how those CAMHS waiting times are going to come down sooner than 10 years?
I think there was very significant waiting for CAMHS across the country. I think in the last 3 months period, 130,000 children were seen for a first time. Of those seen, the median wait is 20 days. So the high priority children being pushed through. There are another 300,000 waiting still on that list at the end of that period, where much longer median wait times amongst those children. So we have a very significant challenge in making sure that our children and young people get access to services. Now, we have been investing in CAMHS. I think I said at the beginning, the mental health spend over this period is up from 11 to 17 billion, 40% increase in staff. We've been working to try and put more mental health services into schools. So I think we now have nearly 500 schools-based mental health teams covering about 40% of the school population. Obviously, the government has got a commitment to take that to all children. So I think we've been trying to find both ways of boosting our existing services and to find new ways of finding new services that might help children earlier on. And then I think, as I said earlier, that some of these services are really very challenged, and we're looking again at just what our model is. I think ADHD being the one where actually is currently out. We've got a task force looking at that because actually we're not really sure what the right answer is.